Good morning, everybody. I'm Dr. Johan Christopher, consultant cardiologist at the CARE Hospital, Hyderabad. And today we'll be talking about a very important topic, and that is hypertension. Very interesting to know that the understanding of hypertension has evolved over time. And there is a statement which was made by John Hay, who was a professor of medicine at the Liverpool University in 1931. And that was, there is some truth in the saying that the greatest danger to a man with a high blood pressure lies in its discovery, because then some fool is certain to try and reduce it. Now, this was the concept of blood pressure way back in 1931. And many years later, we do know that hypertension is one of the biggest killers that is there in the world today. And it is also a silent killer. Now, what is blood pressure? Blood pressure is a lateral pressure exerted by the blood on the walls of the blood vessels. Normally, it should be less than 120 by 80. 120 is a systolic blood pressure and 80 is a diastolic blood pressure. And hypertension is defined as a persistent elevation of blood pressure in the arteries beyond its normal values. Now, the category of blood pressure in adults is anything less than 120 by 80 is normal. Anything that is more than 120 and less than 129 is abnormal or elevated. And the stage 1 of hypertension is a blood pressure which is more than 130 but less than 140 systolic, more than 80 and less than 90 diastolic. And stage 2 is defined as a blood pressure of more than 140 and a diastolic of more than 90. It's very important that when you make this staging, you must have an average of 2 careful readings obtained on more than 2 occasions, both for systolic and diastolic blood pressure. So the other criteria that we look at is normal pre-hypertension, hypertension stage 1, 2, and 3. And the prevalence of hypertension is, all over the world has risen from almost 6 per 100 in 2000, and now it's rapidly approaching almost 50 to 60 patients per million. So from 60 people with hypertension per million, it's now about 107 patients per million, and this is Indian data. What is also important is that there is a significant rural lag in terms of awareness of hypertension, in terms of treatment of hypertension, and also in terms of control. But what is dismal is that even in the urban population, the control of hypertension is less than 20%. Now, the etiological factors in essential hypertension are a sympathetic nervous system overactivity, a renin-angiotensin system overactivity, increased salt intake, obesity and insulin resistance, genetics and family history, endothelial dysfunction, and low birth weight babies. Secondary hypertension is also an important entity, which is generally because of renal parenchymal disease or renovascular disease, primary aldosteronism, obstructive sleep apnea, drug or alcoholic induced. The modifiable risk factors for hypertension include current cigarette smoking, secondhand smoking, diabetes mellitus, dyslipidemia, overweight, physical inactivity, and unhealthy diet. The fixed risk factors that we cannot change are CKD, family history, increased age, low socioeconomic status, male sex, obstructive sleep apnea, and psychosocial stress. And this is important to know because we need to focus on the modifiable risk factors and try to tweak them as much as possible so that the blood pressure is controlled. The determinants of blood pressure in the body is the cardiac output, which is a product of heart rate and stroke volume, and the peripheral resistance. The RAS system is a very important pathophysiology for hypertension. And we know the conversion of angiotensinogen to angiotensin 1 and 2, and the very powerful effect of angiotensin 2 as a vasoconstrictor, and also in the production of aldosterone by the action of angiotensin 2 causes salt and water retention, and that together causes the syndrome of hypertension. So angiotensin 2 is almost central to the pathophysiology of hypertension. It acts both on the kidney and the adrenal glands, and therefore causes this syndrome. What is even more important is that hypertension causes target organ damage. It causes left ventricular hypertrophy, stroke, nephropathy, myocardial infarction, and coronary artery disease. And we know that cardiovascular mortality doubles with each 20 millimeter systolic and 10 millimeter diastolic of blood pressure increase, such that at a 175 by 105 blood pressure, there's an 8-fold increase in relative CV risk. So, ladies and gentlemen, it is very, very important that hypertension is a very important diagnosis to make. It is a very common diagnosis. The rate of hypertension, both prevalence and incidence, is increasing. Hypertension remains one of the largest causes of heart attack, strokes, heart failure. And there are a number of modifiable risk factors that we can really modify, and we can bring down the blood pressure and therefore decrease this huge cardiovascular risk that is there in the society. So together, I believe what is important today on the occasion of Hypertension Day is we need to go with BP right karo, and we will realize that a huge chunk of our population lives longer and better for a long time. Thank you very much.